Hello, and welcome to the 6th lecture of our endocrine series. Today we will be looking at the thyroid gland. We'll look at the anatomy, the histology, the physiology, and a brief look at disease states. The thyroid gland is found in the anterior neck below the laryngeal prominence, or the Adam's apple. The histology of the thyroid gland is shown here. At its simplest, you can think of the thyroid gland as being composed of bubbles of cells filled with jelly. When we look at the microscopic section, those three-dimensional bubbles have become circles surrounded by cells and filled with a jelly-like material, colloid. The circle encloses a thyroid follicle. Remember, in the thyroid, the follicle is a three-dimensional structure. Here we see only a slice through the follicle. The follicle consists of follicular cells surrounding a jelly-like material, colloid, where thyroid hormone is stored. A very common mistake made by students is to confuse the follicle with the thyroid follicular cell. Remember, the structure in the circle is the follicle, and the structure at the arrow is the thyroid follicular cell. Thyroid hormone is synthesized from the amino acid tyrosine, shown here on the left. Thyroid hormone comes in two active forms. One form has 4 iodine atoms, thyroxine, or T4. The other form, triiodothyronine, has 3 iodine atoms. There are several names used for thyroid hormone. One is simply thyroid hormone. Some people refer to it as T3, T4. Rarely, people will talk about triiodothyronine and thyroxine. And sometimes people will just say thyroxine when they mean thyroid hormone. Thyroid hormone tells your cells how fast to work. It regulates the basal metabolic rate. This is a little confusing, but when we look at thyroid hormone disorders, it will make a lot more sense. The thyroid gland also makes the hormone calcitonin, which helps to regulate calcium ion homeostasis. We'll look at calcitonin in a later lecture. The thyroid follicular cells remove iodine from the bloodstream and combine the iodine with the amino acid tyrosine to create the two active forms of thyroid hormone, T3 and T4. It's important to remember that thyroid hormone synthesis requires iodine. Once made, the thyroid hormone is stored in the colloid, and TSH, thyroid stimulating hormone, triggers its release. This diagram shows you the hypothalamic pituitary control of thyroid hormone. For more details on the relationship between the hypothalamus and the pituitary, see earlier lectures in this series. The hypothalamus senses a need for thyroid hormone and sends a signal, thyroid releasing hormone, TRH, to the pituitary. In response, the pituitary releases TSH, thyroid stimulating hormone, which circulates throughout the body. TSH stimulates the formation of thyroid hormone and increases the growth of the gland. When the thyroid follicular cells receive the signal, they release thyroid hormone from the colloid. The thyroid hormone circulates throughout the body, and it then decreases the release of TSH and TRH. This is an example of negative feedback. You asked for it, you got it, you stop asking. To check your understanding of thyroid hormone, let's look at a clinical scenario. Your cousin Betty Sue heard that taking thyroid hormone can cause weight loss. She feels like she could lose a few pounds, so she takes her mother's thyroid hormone. What happens to Betty Sue's thyroid stimulating hormone as a result? Pause the video and see if you can work it out. When Betty Sue takes her mother's thyroid hormone, negative feedback causes a decrease in TSH secretion. Again, if you already have it, you stop asking. Besides setting the rate of cellular activity, thyroid hormone is required for normal growth and for the normal maturation of the nervous system. Again, this will become more clear when we investigate abnormal thyroid function. In fact, let's start that process now. We're going to spend a bit of time looking at disorders of thyroid hormone. We will look at conditions in which there is too much thyroid hormone and conditions when there is not enough thyroid hormone. Hyperthyroidism is a condition in which there is too much thyroid hormone. Small gas engines, like those in a lawnmower, will often have a small screw on the carburetor that will allow you to set the idle speed. You can increase or decrease the speed of the engine by adjusting this setting. Keep that in mind as we discuss problems of excessive and insufficient thyroid hormone. Hyperthyroidism occurs when there is too much thyroid hormone, and hypothyroidism occurs when there is not enough thyroid hormone. Hyperthyroidism is a condition when everything is too much and too fast. The idle speed is set too high. Symptoms include weight loss, rapid heartbeat, nervousness and anxiety, a fine tremor of the hands, sensitivity to heat. The patient feels warm and everyone else is comfortable. More frequent bowel movements, insomnia, and menstrual irregularities. The patient may stop having menstrual periods. Some causes of hyperthyroidism are accompanied by an attack on the fat pad behind the eye, causing it to swell and pushing the eyes forward. This condition is called Exopthalamos. Here you see a patient before and after corrective eye surgery. Hypothyroidism occurs when there is too little thyroid hormone. The idle speed is set too low. Symptoms and signs of hypothyroidism include weight gain, slow heartbeat, depression, impaired memory, sensitivity to cold. The patient feels cold, but everybody else is comfortable. Constipation, fatigue, menstrual irregularities, heavy and irregular periods, and a particular kind of swelling of the skin called myxedema. You see a picture of that here. Compare these symptoms to the symptoms of hyperthyroidism, and you can see what normal thyroid function is all about. Let's look at another condition that can occur in the thyroid gland when there is insufficient iodine in the diet. Remember that in order to make T3, T4, you must have iodine. What would happen to the TSH levels if the T3, T4 levels became very low? Low levels of thyroid hormone would cause the TSH levels to rise. Since there's insufficient iodine, no T3, T4 can be made, so the TSH levels would remain very high over a long period of time. This would cause growth and enlargement of the gland, but no release of thyroid hormone. This is called thyroid goiter, and you can see an example of that in this picture. Insufficient thyroid hormone during neonatal development and early childhood causes cretinism. The signs of cretinism include mental retardation, decreased growth with skeletal growth less than soft tissues. It gives the patient a very enlarged tongue and a very characteristic way of speaking because the tongue is enlarged in greater proportion than the oral cavity. And patients with goiter will often sound like this. Newborns in the United States are universally screened for this disorder since early treatment can prevent many of these symptoms. This concludes our brief investigation of thyroid hormone and our cursory survey of thyroid hormone disorders. In our next video, we will go into greater detail about thyroid hormone disorders, including causes and medication. Thank you for your attention.